Hi, I'm Dr. Noopur Desai. I'm an oncologist at the Cancer Vet. So today we'll be talking about chemotherapy, which is one of the most common questions I get asked is about what are the side effects of chemotherapy and how we can prevent them in pets. Most of the times, in about 80% of our patients, we barely see any side effects or complications. The main goal of chemotherapy or any kind of therapy in veterinary medicine is a good quality of life. So that's why the dosing is different than people, the intervals are different than people. Hence, the side effects are much lower than what you would see in people. So majority, that is 80% of the dogs, will not show any major side effects. About 10% of them, or actually 5% of them, may require hospitalization because of chemotherapy-induced side effects. So we'll talk about these side effects in detail a little bit. But before that, what is chemotherapy? Now, chemotherapy is when we give cytotoxic drugs, so drugs that are toxic to cells to kill cancer cells. Now, these chemotherapy drugs, while our goal is for them to attack the rapidly dividing cancer cells in the body, but these drugs can also attack other normal rapidly dividing cells in the body, which is basically the gastrointestinal tract, the bone marrow, and the hair follicles. So that's why the main side effects are seen in these three systems, which are almost not that much, but again, these are the three main systems where we could see the side effects at. So first, let's talk about what are some of the main side effects that we see in our practice. Most of the times, these dogs walk in happily, wagging their tail. They get chemotherapy and are out of here in about an hour and a half. Sometimes we notice that they may be a little lethargic on the day of chemotherapy and the next day onward, but outside of that, they do okay. Then let's talk about the gastrointestinal side effects. These can happen from about day 1 to day 5 after giving chemotherapy. Most of these are self-limiting, which means we don't really need any kind of major intervention, which usually are anorexia, which is reluctance to eat. And this may last for about a day or two. In some cases, we do see some nausea, vomiting as well, which is very well controlled with oral medications at home. And in very rare cases, do we have to call them in for an injectable anti-nausea medication to stop the vomiting. In a few cases, we also see diarrhea, which is again self-limiting. So it may last for about 3 to 4 days after the side effects happen, and then they go away on their own. What we normally do in our practice is, before chemotherapy, before injecting chemotherapy, we would give them an anti-nausea medication injectably as well. Our preferred drug of choice is Cerenia, but it is not easily available in India. So it's okay to give either metoclopramide or ondansetron before giving chemotherapy. This can minimize, the side effects of nausea, vomiting. Most of the times when we send our patients home, we will give them a prescription of anti-nausea medications as well, and ask them to give it for the next 3 days if they feel their pet is nauseous. Usually, we do not treat the diarrhea with an antibiotic. I've seen a few people use metronidazole for chemo-associated diarrhea, but there are newer studies out there to show that it really does not necessarily change anything. It does not make the intensity of the diarrhea lesser. So we are no longer prescribing metronidazole for chemo-associated diarrhea. We just increase the fiber in the diet, we'll increase some probiotics, prebiotics, but that's about it. So all these side effects are usually self-limiting and not to a point where your pet is very sick. Then the second part of the side effect profile is your bone marrow toxicity. So chemotherapy does cause damage to the bone marrow cells, and more essentially to the white blood cell count, to the white blood cell called as a neutrophil. Now, neutrophil is required to fight infection in the body. So usually around day 7 to day 10 in most of the chemotherapy drugs, we would repeat a blood work called CBC to see if this white blood cell count or the neutrophil count has gone low. Again, usually even if it goes low, it jumps back up in about 3 to 4 days time. We do not really start with any antibiotics if the pet comes in happy, healthy, wagging his tail. We'll only start antibiotics if there is fever associated with the low neutrophil count, or if the neutrophil count is below a certain level. Otherwise, in I would say most cases, they're just sent home without any prescription really. Very rare cases though, the neutrophil count falls to a certain level where we would ask the pet to be admitted, and this would be an emergency. If the neutrophil count level is low and your pet is febrile, which means if they have fever, in that case there's a chance they may be getting septic. So in that case we would hospitalize the patient, we would put an IV catheter in sterile conditions, put them on fluids and put them on IV antibiotics. Most of the times within a couple of doses or an overnight stay, the fever goes away, the neutrophil count starts jumping back up. So as soon as that happens, we send them home because we don't want them to spend too much time in the hospitals. Very rarely do we have to use a granulocyte stimulating factor, which is basically an injection called filgrastim. Very rarely do we have to use that. I mean, we'll only use it if the WBC count of an hospitalized patient is not going higher in about 24 to 48 hours and the fever is not really subsiding. Otherwise, we don't normally use filgrastim. I've seen a lot of people use filgrastim even if the WBC count is not that low, the neutrophil count is not that low. It's absolutely not necessary. I know that they do it in humans, but that's because the protocols are so intense. They need the WBC count up before they give the next chemotherapy. We don't really do that in our veterinary patients. So again, most of the times, even if the WBC count goes low, even if the neutrophil count goes low, most of these are wagging their tails, doing pretty okay usually. And then one of the most important questions I get asked is, in humans, they lose their hair. Is that what's going to happen to our pet as well? Most of the time, there is no hair loss. They don't get alopecic patches. What will happen in cats is they may lose their whiskers and they will come back once we stop chemotherapy. In a few breeds though, like poodles or shelties, vesties, they may lose their hair coat. So the reason for that is usually in dogs they have a seasonal shedding of hair and then it comes back, versus in people the hair is continuously growing. And in certain breeds, poodles, so on and so forth, poodles, labradoodles, this can happen because of that quality of the hair. Otherwise, we don't commonly see alopecia or loss of hair at all. Typically, what we've seen is cats tolerate chemotherapy much better than dogs, surprisingly. Very rarely do we have cats having nausea, vomiting. A lot of times what we see is maybe a slight reluctance to eat, which is also quite short-lived. I also want to talk about a very important, I would say, point, which is your own safety. So if your pets are going through chemotherapy, there may be trace amounts of chemotherapy that are excreted in the urine and the stool. So whenever you're picking up the urine and the stool, ensure you're wearing gloves while doing that. Because whenever we are delivering chemotherapy or mixing chemotherapy, we are very, very careful. We'll wear double gloves, we'll wear a mask, we are fully gowned. All of these will be disposed of. We'll wear a shield as well. So these drugs are cytotoxic, and hence you want to take care of yourself as well when your pet is going through chemotherapy. So ensure that while they're going through chemotherapy, for at least the first week post chemotherapy, you're wearing gloves and not coming in direct contact with the urine and the stool. Very commonly, the pet parents come in and say, look, doctor, I don't want to put our pet through, all the side effects that we see with chemotherapy. So I'm here to tell you that most of them do well. So maybe give it a chance. Usually when I'm talking to a pet parents, what I do mention is you can try with one dose. You can try with one dose, and if the side effects are minimal, if you think the quality of life is acceptable, you can continue with the chemotherapy. If we feel that the side effects are not very good, the quality of life is not good, we always have the option of stopping. It's not like just because you've given one chemotherapy, you have to finish the entire protocol. So maybe give it a chance and see how they do. Most of our dogs are doing really, really well. When we ask our pet parents about their experience with chemotherapy, I would say most of them are happy that they're doing it. The dog's quality of life is good. They're running, they're having fun, they're eating quite normally. So I would say maybe give it a chance. I remember a sentence that my faculty or my mentor used to say, do not make the treatment worse than the disease. And that's what we go by. We do not want to make them sick just so that we can extend their life by a few months. That's not what our goal is. Our goal is to give them an excellent quality of life and as well as extend it. And that's why we ensure that the side effects are lesser. Next time, we'll talk about radiation therapy. What are the different types of radiation and what may some of the side effects be? So till then, see you next time.